Hi, and welcome to this episode of the Carer Project podcast. My name's Christine, and I'm here with Gun Grand.
Hello.
Hi, and with Alison Weirden.
Hello.
Hi. So the Carer podcast series, we're discussing some of the findings that have come out of this project. We're concentrating on various themes, and we've got several themes, and each podcast relates to a different theme. And we've also got a podcast on carer recommendations with our fantastic carer chairperson, Jackie Flynn. So do make sure you listen to that. Today, we're going to be discussing the theme of support. But Gun, before we get into that, do you want to tell us a little bit about the project for anybody who's listening to this episode and it's the first in the series that they've tuned into?
Yeah, so the background to the project is working out how we best support family and friends who are looking after somebody who is nearing the end of life. And the reason we are doing that is because we know that these carers are essential in supporting patients. But we also know that caregiving can also take a toll on carers' own mental health and well-being. So carers do this voluntarily and willingly, but they often suffer as a consequence. And the point of the project is to look at what are the factors that may make carers' mental health better or worse during caregiving for somebody at the end of life, to see what is it that we might be able to change or that we need to look out for to help carers be more resilient and maintain their well-being.
Great, thanks. And I think it's important to say as well, when we're doing our podcasts and we talk about mental health, we're talking about improvements in or a deterioration of things like anxiety, depression, distress, and quality of life.
Yeah.
And the theme that we're talking about today is support. So, Gun, again, do you want to tell us a little bit? I mean, support just seems like a huge, what on earth does support mean when we're talking about carers and their well-being?
Exactly. When we're talking about support, it is very broad, but it is generally how well carers feel supported by health and social care professionals, and how well they feel supported by other friends and family, and how good that support is seems to affect how good their mental health is. It can either improve their mental health if the support is good, or be bad for their mental health if the support is less good.
Okay, so why don't we dig down a little bit further into that? So obviously that's the top line. If the support's there and it's good, it seems to be protective of mental health or helpful towards mental health. But what exactly does the research say? Where it sounds like there's some contradictions in there. So what did you find?
Well, I think it's uniformly clear that this was a topic that was most important to carers themselves. When we look at the qualitative research, that is the research that enables carers to talk about their own experiences, the importance of good support was the theme or the factor that came up most frequently. But that does cover a broad spectrum. So carers would talk about whether there was enough care available, whether care was disjointed or they had enough information, and also important was whether the professionals that were supporting them showed empathy, whether they had sufficient skills, whether they had good communication with them, whether the carers felt that they were being listened to in terms of what they and the patient needed, and also if there was a lack of recognition of the carer's expertise or poor collaboration, this was also detrimental. So again, a range of themes, but all seem to be very important to carers under this broad theme of support. And as we said, also support from family and friends. So informal support, as we say, seem to be very important.
Yeah, I would agree with you. Going when I look back over the qualitative work, I was struck by the number of different things that people spoke about under the rubric of support, both emotional support and then much more practical things like informational support, as you said before. And I think that the complexity of support, even though it's something that we all sort of know what it means when we're talking about it in our day-to-day life, the complexity of the construct makes it something that's actually quite difficult to measure in the quantitative studies, for example.
Yes, and the when we looked at the quantitative studies or the studies that use numerical and statistical information, we often got um, inconclusive or sort of contradictory results. I mean, I think overall it's fair to say with the numerical or quantitative data, it was clear that a lack of support had a negative impact, and that good support was positive for carers' health. But as when you try to unpick exactly in terms of numbers, what it was about that support, then it became a bit complicated. And I don't know what you think, Alison, but that might have something to do with how difficult these things are to measure.
Yeah, I think very much so. I do think it's really quite difficult to measure support. I mean, there are quite a few different models of support in the psychological literature, but we are usually trying to measure support by asking people some rather simple questions on questionnaires. And sometimes I think that that can lead to us getting some rather counterintuitive findings. There was one finding that we had that was one of our studies found that people who had professional psychological help actually had poorer outcomes. That was only one study out of 3 that looked at that. And this could be something to do with the way that the psychological help was measured. It could also be something to do with the direction of causation. It could be that people who had poorer psychological health were more likely to seek psychological help. But exactly. Yeah, I think that the whole area is really quite complex.
I think that's why we, as we look further into this area, we need to listen very much to carers' experiences of what is supportive to them, what helps, and then look at, okay, if we're going to try to measure what is most important in all of that, we need to work with carers to look at how do we actually measure this so that it's meaningful for carers, and we need to look at what is cause and effect in this as well. So it may well be that carers indeed who have the most pressing mental health needs will seek out psychological support, and that's why it looks like high mental health problems is related to more psychological support. Whereas we have to look at the journey and the process to see whether did that psychological support then lead to them having improved mental health, for instance.
Absolutely. I think this is where the caregiver's own storytelling can really help us unpick. So we're talking here about the quantitative or numerical literature and the literature and the studies that have been based on numerical data. And was there a lot about support in the qualitative literature when we looked in interviews and focus groups with carers where they were describing their experiences in their own way?
Yes, I mean it did come through in carers' own experiences. That really came throughout. There were a lot of factors that could affect carers' mental health during caregiving, but support in one shape or another was kind of the factor or the theme that came through again and again. And yes, we mustn't forget. I mean, there was a lot of reflection on the importance of support from health and social care, but we also need to look at the benefits of a good support network around the care family and friends, and also support from others who have been in the same place, i.e., carer support groups or um, body systems for carers being able to get support from others who have been there, done that, know what it feels like. So that's another really important aspect of support we need to be aware of and seek to strengthen.
Great. Thank you, Gunnar and Alison. I think that covers really nicely what we've captured in the extensive piece of work that's been conducted as part of this project. I suppose for any professionals listening, healthcare professionals or carers themselves, how can people use this information in practice about support and some of the things that you've just been talking about the support networks? What can we take from this that we can put into practice?
Well, we've had some great help from our carer review advisory panel on this project, a really great team of carers who've worked with us throughout the project. And they helped us look at the findings from the research, and they developed recommendations for the components of support that need to be in place in order to help and support carers. So these include key things like making sure there's awareness raising, both in terms of making carers aware of what help might be available, but also helping healthcare professionals be aware of carers' needs. Carers also, they said, need a roadmap to help them navigate end-of-life caregiving.
So that's where that buddy system is really helpful as well to help inform that, isn't it?
Exactly, yeah. Both the body system and also perhaps professionals thinking about, okay, what do they need to know ahead? They were talking about the importance of assessment of the situation and needs of individual carers, because one size doesn't fit all. They were warning against, assessing patients' needs without taking into account how much of that need is actually, or how much carers help manage that need.
Right.
So often an assessment can well say, oh, the patient doesn't have any needs. Well, that's only because there's a carer in the background working like mad to make sure they're all right.
Yeah.
And they were talking about the importance of coordination and timely care by having somebody like a key worker support them. And they mentioned also a lot of practical support they do need in terms of advice about finance, meeting practical needs, basic physical needs. And so I think these are really key starting points. And I think if people are interested in hearing more about what the Carer Review Advisory Panel recommend, do go and listen to that podcast because there's so much valuable information there.
Absolutely. So that's the podcast we recorded with Jackie, which I mentioned earlier on in this episode. We've also got on our website an overview of all of the carer review advisory panel recommendations, and there's a short version of that, so that's quite an easy read in the short version. And we've got some infographics as well which draw on those recommendations as well, so again, even easier to access if you're a healthcare professional, to stick up a copy in your waiting room or in your consulting room. So all of those things are available on our website, which will be linked somewhere with this podcast episode. And we've also got links from Twitter, or X as it is now for those who are up on these things, and our Twitter handle is @CarerProject, all one word. So I think we've probably chatted a fair bit today about the theme of support. As ever, there's a lot more information on the website in terms of the qualitative literature, so that's all the interviews and the carers' experiences in their own words. We've got a review of all of the evidence that's out there on the statistical research and the numerical data that's coming through. And there's also reports on the work that we did with the carers, working in co-production with carers as well. So there's huge amounts of information and data that we've extracted available on our website as well. So I'm just going to thank Gun and Alison for being here today, and hopefully we'll speak to you again soon in the next episode.